Oh, hey there! Thanks for stopping by because you just made the right choice. Today, we will be teaching about our body, the anatomical terminologies, and body plans. Stay tuned because you're about to learn such wonderful information. Let's start learning.
Before we take a look at the meaning of anatomical term, I suppose the first question that we answer is, why do we use anatomical terminology?
This exists so that we precisely describe the location of the features on the body. If we use correct anatomical terminology, it is possible to precisely identify the location of any other body feature. Before we proceed, take a look at the woman's body in this position. In this image, she is now standing upright, arms at side, palms facing forward, and feet together. We call this the anatomical structure of human body. Other terms are supine and prone. When we refer to a supine position, the subject is lying face upward. If the patient is in prone position, the subject is lying face downward.
Okay, let's now proceed to directional terms. First, the left and right. Referring the left and right side of the body on the anatomical position, the left hand and the right hand. As we look on the picture, this is the left side and this is the right side.
Next, superior and inferior. Superior means above, towards the upper part of the structure. Inferior means below, towards the feet or lower part of a structure. Next is proximal and distal. This term is only used to describe location of 2 points of some limb, which is arm or leg. Proximal means closer to a point of attachment. Distal means further away from a point of attachment.
Next, medial and lateral. Medial is any point closer to the midline of the body. The midline is an imaginary line that cuts the body in half vertically, while lateral is farther away from the midline. Deep and superficial. Deep is away from the surface of the body, while superficial is surface of the body.
Directional term describes the position of external structures and describe parts of the body relative to each other. If we want to observe the internal structure like heart, lungs, and the brains, to do this, we have to cut in slices, called planes and sections. There are 3 anatomical planes: sagittal, frontal, and transverse.
Sagittal plane. Lengthening cut. A vertical cut that divides the body into left and right position. If the cut is through the midline, it is called mid-sagittal plane.
Another one is frontal, or sideways cut. It divides the plane into anterior and posterior portions.
Transverse. This is a horizontal cut that divides the body into superior and inferior portions.
Next in our discussion is the body parts and regions, the abdominopelvic regions and quadrants. The abdominopelvic regions and quadrants are the subdivisions of abdomen, which are separated by imaginary lines to demonstrate the relationship of the organs.
There are 4 quadrants on the abdomen, and these are right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. There are also 9 regions that this area consists, and these are right hypochondriac, left hypochondriac, epigastric, right lumbar, umbilical, left lumbar, right iliac, hypogastric, and left iliac region.
This image shows the anterior view of other body parts including the head, neck, trunk, upper limb, and lower limb that includes subparts that are enlisted on the illustration. And here is the posterior view of other body parts. And last on the line of discussion is body cavity. It is a fluid-filled space inside the body that holds and protects internal organs. Human body cavities are separated by membranes and other structures. That ends our discussion, and thank you for listening. Have a good day, everyone.